having the talk with your parents, let's rewrite that for a new generation, this time with less awkward silences and more actual conversation. Hi, I'm Dr. Bala. I'm an integrative women's health specialist, and my absolute favorite part of what I get to do is educating. I want everyone to understand their bodies inside and out. And this is going to start with our teens. Those awkward years of not knowing the changes going on inside our body and not feeling comfortable enough to talk about it stems into adulthood where we feel like we're fighting with our body instead of just flowing with it. And this is where I want you to start with your teens by opening up that conversation so they know that it's a subject they can talk to you about. Ask them what they know. What have they learned? What have they been hearing? Because they might be hearing things from their peers that just isn't correct. Ask them what they're concerned about too, because our concerns as parents might be, are your periods regular? Are you in pain? Are you bleeding too much? Whereas they're probably more concerned about their discharge or what product they're using. In fact, my most commonly asked question by teens is my discharge normal? And here's how you can answer that. Discharge is totally normal to have, and we all have different amounts of discharge. Some people are going to worry that they have too much discharge, but that might just be your norm, and that's totally okay. Healthy discharge is going to be either clear or white, and it's for the most part pretty odorless, maybe a little bit musky. Everyone's has a unique smell, but it's not going to be foul smelling. It shouldn't be foul smelling. It's also going to be a little bit thin or slightly creamy in texture, depending on where you are in your cycle. And that's the other thing. Discharge is going to change throughout the menstrual cycle with the fluctuation in hormones. So, when should you see a doctor about the discharge? When is it concerning? If you see a change in consistency, if it starts becoming really chunky or cottage cheese like in texture, that might be a sign that something is off and worth getting checked out by your doctor. If you see a change in color outside of the usual clear to white, if you see like green or yellow, gray, foamy, or frothy discharge, this can be a sign that you should go see a doctor. And if there's a strong odor that's fishy, foul, or yeast smelling, that's another sign you should go see your doctor. If you see blood in your discharge and it's not associated with ovulation, or if you notice any burning, itching, irritation, or redness in the vulva or vagina, all of these could warrant a checkup just to be sure that there isn't an infection going on. And of course, if something feels off, it's always best to get checked just in case. The best thing that you can advocate for with your teens is them being part of their body. Get them paying attention to these things so they can let you know when something is off. You are going to be their safe space for anything period related, anything menstrual health related. Keep in mind, this video is purely educational. If there are any concerns about your child's health, please be sure to check in with their doctor. So, what are some other frequently asked questions that I get about periods from teens? The next biggest one that I often get is, can I still do sports and other activities while I'm on my period? Obviously, we all want to just keep doing our daily activities, right? And the answer to this is yes, your teen can still continue all of their daily activities to their comfort level. Some might feel a little bit more fatigued during this time, and some don't. So if they feel comfortable and they have the energy to continue their activities, they absolutely can. And my third most frequently asked question is, why haven't I gotten my period yet? The average age of first periods is about 12 and a half, and everyone's body is different. Typically, your period starts about 2 years after breast bud development and pubic hair growth. So, if this hasn't happened yet, check in with your child's pediatrician. It's worth it to get some lab testing if this feels concerning to either you or your teen. Another concern that I get is how much bleeding is normal. This is actually something that I hear a lot in my practice from adults too, not just teens. So, here's what I want you to look for in a healthy menstrual cycle for either you or your teen. Bleeding should be between 3 and 7 days. If it's less than 3 days or more than 7 days, this might indicate a hormonal issue. And I want you to count the days that you bleed as the first day you see bright red blood and need to use a pad, a tampon, or any other period product. If you're only using a liner, that's not the first day. This might be spotting, which I do still want you to keep track of, but don't count it as the first day of your period. We want to see bright red blood as the first day of our period. We also want to look for how often you're changing your products. This usually applies more to pads or tampons. So if you're changing them out more than every 2 hours, this is considered heavy bleeding. And if you use a menstrual cup or a disc and you are changing it more than every 6 hours, that may also be heavy bleeding. Another sign is if you have blood clots in your period blood that are the size of a quarter or bigger. Or if you're doubling up on your products, if you wear a tampon and period underwear or a pad just in case, that might be too heavy bleeding. And the last thing I want you to keep track of is if you're having to wake up at night to change your products because you bleed through them. This could also be a sign of heavy bleeding. So, the number one thing I want you to keep in mind today is that it's normal for us to all have questions about our body. Creating a space where your child can talk to you about their body is the best thing that we can do for them. So, educate yourself so that when they do come to you with questions, you can help guide them clearly and give them the body literacy that we may not have gotten when we were younger.